You are welcome to my channel. Thanks for visiting. You've gone a long way with me along the journey of respiratory failure and the fires surrounding. We've gone through respiratory failure types 1, 2, 3, and 4. Today, we are at a bus stop, and that is the signs and symptoms of respiratory failure. Without further ado, let's go. The signs and symptoms could be clinical, and let me quickly go into that. Clinical presentation of respiratory failure. Number 1, agitation. Wow, agitation. This is an individual who had probably been admitted before now, never known to be aggressive. Suddenly, he or she has become agitated. Then we should find out. It might be respiratory failure. The first thing is we don't look for haloperidol because of this agitation or seek order to restrain. Let's do first thing first. What is the O2 sat telling us? The O2 sat value that is likely going to be low will give us clue to have arterial blood gases done. Then we'll be able to deal with the pH that will be low, CO2 that will be high, partial pressure of oxygen that will be down, and bicarbonate that will be shifting, in direction, trying to compensate, thanks to good renal system, right, that will pump bicarbonate to the circulatory system. We can easily look at this patient. Is this patient using accessory muscles of respiration, nasal flaring, supraclavicular retraction, suprasternal retraction, or intercostal indrawing? And of course, we take our vital signs. What is the respiration telling us? Is it tachypneic? Do we have tachycardia here? Any diaphoresis? How about the pattern of the blood pressure, depending on the type of respiratory failure anyways. If we're dealing with type 4 with shock, we'll be dealing with hypotension. Then we can be battling with hypertension. Then cyanosis, central or peripheral. Then when the value of CO2 has increased appreciably, we will have CO2 narcosis, with decreased level of consciousness. Some individuals can go into somnolence. Then abdominal paradox for diaphragmatic fatigue is a possibility, particularly if we have neurogenic shock below the 5th cervical vertebra. There will be diaphragmatic breathing here because the intercostal muscles that are controlled by the nervous system has derangement right now. So we are going to deal with all this in the face of respiratory failure. Now let's look for signs on the chest X-ray. If the chest X-ray is taken and returns to be clear, then what is the arterial blood gas telling us? If CO2 is high, that is increased CO2 hypercarbonic condition with a clear chest X-ray, let's consider COPD first. COPD. But the history would have offered some further clue if it is asthmatic. Okay? Wheezing, but not all wheezing is bronchogenic asthma. But bronchogenic asthma will wheeze until there is complete obstruction. In complete obstruction, you can pick silent chest, yet it is asthmatic, but the patient is about to die. If it is neurogenic in origin, the chest X-ray may be clear with increased CO2. Yes, this is respiratory failure. Now, the chest X-ray is clear, O2 sat is dropping. Oh, let's consider pulmonary embolism. Are we dealing with shunt right to left, or we are dealing with shock with hypoperfusion? Now, checking the chest X-ray again, we will pick infiltrate, but infiltrate is localized, it is not diffused. If that is the case, let's review the history again. Is this post-operatively? If that is the case, we might be dealing with type 3 respiratory failure with atelectasis. It might be pneumonia, but we have fever, and other signs related to pneumonia. However, in elderly, you are not likely going to pick fever. So it might still be pneumonia in elderly with normal temperature. If the opacity is diffuse, not localized, and the O2 sat is dropping, but CO2 is between the normal range, pointing to type 1 respiratory failure, right? Then we might be dealing with pulmonary fibrosis. It might be acute respiratory distress syndrome, and it might be cardiogenic in the case of congestive cardiac failure. It may be non-cardiogenic when IV fluid has been given beyond limit and there's now pulmonary edema. Of course, LASIS will help us fast in solving that. With that, I've come to the end of this short presentation when it comes to signs and symptoms clinically and on chest X-ray as per respiratory failure. Thanks for listening. Please share this with everyone. I appreciate it.